Good afternoon, everyone, and welcome to our presentation on using the Public Health Digital Library. We are so happy to go ahead and be sharing this information with you all today about this wonderful resource that we have access to as OPH employees, this Public Health Digital Library. Once upon a time, if we wanted to, as OPH employees, if we wanted to access peer-reviewed journals, full-length academic journal articles, we did not have a way across the board to access them in a timely manner for free. A lot of times it was just trying to, hey, do you know someone who is affiliated with some university and they can access it on your behalf? Or, you want to pay for this download or try to email so-and-so who could kind of get it for you. A lot of runaround, and we need this information to do evidence-based public health work. This is critical for all of us to be on the cutting edge of what's going on in the field of public health and health more broadly. So we are very excited to have this resource that we at OPH pay for so that all of our employees can use this wonderful resource. And before I hand it off to our presenter, I did just want to share a personal use case for myself. How do I use this Public Health Digital Library? I tend to be more of a browser than a searcher. I have a journal, a couple journals, but one in particular that I love to keep abreast of. It's called the Journal of Public Health Management and Practice. So I go in there regularly to that journal specifically. I browse the recent issues. In the latest issue, there is one on social determinants of health, the approach taken at CDC. And so CDC is our funder. And now I can read about the latest of their framework for how to address social determinants of health. So this is directly applicable to our work. So that's enough about by way of introduction. Now I'd like to hand it over to our presenter, Cecilia Vernes, who is with the National Coordinating Center, and she is the educational coordinator for the Public Health Digital Library. So Cecilia, it's all handing it over to you.
Okay, great. Can everyone hear me? And I assume you're seeing this cover screen. Oh, thank you so much. Yay, a voice. And we are recording. I just want to verify we're recording. Okay. So welcome to this session. I'm the education coordinator for the the network of the National Library of Medicine Public Health Coordination Office, or what we call the NNLM. I am based at University of Massachusetts Chan Medical School in Worcester, Massachusetts. So if you're familiar with Boston, it's about 45 miles directly west. And I have been in this role for approximately 6 years, nearly. So what I'm going to be showing you today is something you already have access to. So let's just give you a quick review. When we're talking about evidence-based public health, we're talking about the process of systematically finding, appraising, and using contemporaneous clinical and community research findings as a basis for decisions in public health. I felt like this was the shortest and most succinct definition of what we're speaking about when we're talking about evidence-based public health. So just a few quick things. We're going to keep the chat open for questions and comments. Katie and I will answer as we are able during the presentations. I'll be focused on the demos and such, but if there are questions that come up, we will take a look at those. Go ahead and mute yourselves if you haven't already. And this session is being recorded, and I'm going to make sure that a copy of the slide deck is made available as PDF. And as I mentioned here, Katie Kane, she will be your contact, or what we call a PHDL coordinator at your Office of Public Health. And if you want to follow along with the demos, you can log into your PHDL account if you know what I'm speaking of, or you can go, if you're on the network or in the office, to nphco.tdnetdiscover.com. I'll explain a little bit more about that, but let's get started. So just to put a framework around this, I used to have a red banner that said COVID-19 across all these issues, but I've been told that kind of still dealing with COVID-19, but all these other public health issues that have continued and been in the past are going on in all the states in the US. However, the order and how they appear on the list, which one is first, tends to differ. So putting the frame around these public health issues, the 10 essential public health services framework was redone in 2020. I've included a link here to the slides with the toolkit so you can get graphics and more details, but you'll notice the center is equity. So if anyone was at APHA this year or submitted an abstract or presented online or anything for research, an equity lens, a health equity lens is what we're putting on all practices. And I'm going to try and emphasize a little bit of this during the presentation. And also kind of what does that mean when you're looking for resources in the public health digital library or in the public health research space in general. So just to give you a quick overview, when we say digital library, this is the model we have. Your department has access available either through the intranet or listing that URL that I posted. And in addition to that, for materials and articles that are not accessible from our digital library, you have a partner library that's agreed to provide your resources. And so with that, you have access to this timely evidence-based information. Just to show you, you're part of a larger, what I would say, cohort or community of users. There are over 30 sites. Some in this program are at the municipal or at the county level, and others are even in some cases at the city level. So you are in a good group of people who are trying to use evidence to practice evidence-based public health. So what's in the digital library? Well, it says 290 journals. It's more like 300 plus, give or take 30 or 40. Ebooks. I'm not sure if you're familiar with using ebooks, but they are accessible from what we call the StatRef collection. Systematic reviews are available through the Cochrane Cochrane database systematic reviews. We also recently added, about a year ago, the data mapping and GIS tool called Policy Map. It enables you to do creations of maps based on data. So you have this combination of doing sort of, informatics kind of work, but not having to have to code it or anything like that. And I'll be showing you briefly what that looks like. The global health database is accessible, available through CABI, of which about 40% of citations are not available in PubMed. And also they have a collection of full text hosted in their database. And then finally, for laboratory standards, we have the Eclipse database. On the left here, or my left, is a screenshot of what we call the PHDL Central webpage with the URL listed above. So when we're talking about all these resources that I just gave you the names of, and probably can feel a little overwhelming, but let's see if we can map the type of resource to a particular, what I call research or reference question. So if you want to find something in the latest research on substance use disorder in women, well, tipping off latest research, I would start with PubMed. And we have a PubMed search tool that's within the PHDL Central webpage. The next question, if you're looking for smoking cessation tools, you might want to consult a few different things. StatRef is an idea. Cochrane Database of Systematic Reviews does have some systematic reviews on smoking cessation practices and treatments. You might also, if you're working with individuals or smaller communities, look at Medline Plus and also Community Guide, as well as maybe Bookshelf. And finally, this other example here, focusing on global health, but also laboratory systems. Zika virus has been found in the community. What's the best test, or what kind of titration information is needed in the lab? You could consult Eclipse. And then if you're looking for how other countries have experienced Zika, you can consult CABI Global Health through the Global Health Database. So you're probably wondering where to find the PHDL. So here we have a screenshot from the Bureau of Planning and Performance intranet page. Highlighted in orange, it says Public Health Digital Library, and then here is the link. I can leave this on here a moment while you connect, if you are so inclined. And Katie can share that in the chat if possible. So what if you're not on the network? What if you're working from home or you're not on VPN? You can access the PHDL from outside. You would just have to create a login to your account. And Katie has that detailed information, but it's also listed here on the slide. We have a blog post about it. You would create an account and then you would connect. So this is what the page looks like. I put the URL up there again. You're probably wondering, of the 300 journals plus, which ones are accessible? So we have some of the what we call heavy hitters and listed in our top 10. So these are based on statistics from the whole program. So New England Journal of Medicine, but also some more smaller and in some cases really accessible ones like Tobacco Control from BMJ or Journal of Wildlife Management, Clinical Infectious Diseases, Oxford University Press. We work with about 30 plus publishers to provide resources to the collection. And now I'm going to switch to demo. So give me a moment. I'm going to stop sharing and I'm going to show you the page. Okay. Can everyone see the central web page? Okay, I see Katie nodding. Thank you. Okay. So it was a screenshot, now it's reality. So there are a couple of things I want to show you here on how to navigate this page. The main part is this e-resources list, but actually let's do that. Let's show you the journals first. So I want to know how many journals are in the collection or just see what the list looks like from what we call A to Z. I'll click on journals and then click on all. And I can scroll all the way down here. And there's a drop down where I can select, you know, the section of the list of journals. And since I clicked all, it's going to be really long and I can change things like how many items I want to show, but I could then click on the journal title, which takes me directly to the publisher's page. I could just click on article. Okay. And now I click on PDF and now it's taking me to a PDF of that article. So that's just accessing just at the journal level. If I go back, I could do the same thing with books and I can do the same thing with databases, but let's go back here, back to home. I'm going to show you what I call the one-click tools. You probably wonder what policy map looks like. I'm just going to give you a very quick orientation. So you can type in Louisiana. And okay, so now I've got this location and I'm going to say demographics. I'm going to look at age. We'll say median age. And as you see, as you roll over the areas, you have it listed by county, which is kind of nice. So you have click on the county. It can show you trends. That's a new thing that they added to their newest release. I can add data points. I could say under health, I want to look at health facilities, hospitals, quality of care, Medicare certified. All these little blue crosses here are a hospital. And in addition, where available, it's going to have things like admissions, care measures, that sort of thing. And you see here it says CMS HRSA. So that link can take me to what we call the data dictionary. And in the data dictionary is a description of what the data is describing, written out as well as the last time it was updated on Policy Map and other tools. Okay. That is Policy Map. Global Health. So here I'm looking at tick-borne diseases. I can click here. Looks like this is an abstract. It might not be available full text. I don't see a CABI hosted, but if I want full text in my search, I can change my search. I can go right here to CABI hosted full text and click on the checkbox and just say refine results. So now I see these available as full text. And here's something about a vaccine. So granted, remember it says global health, so it's not necessarily US based, but this is talking about a vaccine. So that is CABI Global Health. Cochrane Library, which contains several databases, but we like to focus on the Cochrane database of systematic reviews. This is the database it takes the longest to authenticate to, so that's why it's not working. There we go. If it continues not to work, we will demo another, and there you go, okay. So there is a global health group, but I like to use the example smoking cessation, say treatment. And we've got a systematic review on mindfulness. What's nice about this is you can view the PICO or PICO. So if this is the population that you're interested in for the systematic review, 65 plus, smokers and adults, you're looking for mindfulness as an intervention. With tobacco abstinence as an outcome, as well as these other outcomes, this could be of interest. So let's say we're interested, we can click here on the citation, and then now, quickest way, you could read this, or I like to just view it as a PDF and look at the summary. What's nice about this is not only do you have an abstract, but you also have a plain language summary. So if this is going to be used for planning for programming or applying for grants, you need something more plain language, is a good resource to consult. And then finally, we have our ebook collection. You can click on any one of the book covers. Of course, this is taking me to evidence-based public health. We have that available, the textbook. But let's say I do something like this, and I type health equity. What's nice about StatRef is, different from PubMed, it searches full text. So the closer that the terms health and equity are to each other, the higher up on the results list is going to be the result set. So this is from the Joint Commission, and it's strategies for accelerating health equity. Granted, this might be more clinical, but it also lists social determinants of health from Healthy People 2020, and it's got some general information. If I want to go to the next result, I can click on result. And this is taking me to a different resource. This is from the pediatric collections promoting health equity. So you're seeing that we're going through the resources. It's not necessarily all in the same ebook. And I can click on back to results. So that is StatRef. If you just want to see one particular ebook, you can search for it in titles, or if you see it on the carousel, you could just click on the book cover. It'll take you right to that carousel book cover. So like disaster nursing, it'll go directly to that. Okay. What questions do you have before I show you citation matcher and searching PubMed?
What an amazing resource. All of these books that are very expensive if you were to buy them, and they're all at our fingertips. So that's wonderful.
Yes, that's a good point to bring up, is that some of these ebooks are consulted on a regular basis, especially the Red Book. If anyone is working on childhood immunizations, Red Book is included in the collection. And what's great about StatRef is that if there is a new version or new edition that comes out, it gets automatically added to the collection and updated. So if Redbook comes out for 2023, it'll be available as soon as it's available electronically, and StatRef will handle that for you. There's also a nice ICD-9, ICD-10 conversion tool, and I can share that to you later if we have more time. So I want to show you Citation Matcher. Let's say you've published an article, or your friends published an article, and you know pretty much almost the entire title. You could start typing the title. In the search box. And I'm looking for an article in particular, so I know which one it is. I'm going to scroll down here. It's Reframing Incident Command Systems. It's from Washington State Department of Health Laboratory. So number one, you have access to the American Journal of Public Health, which is an association published journal, which wasn't initially included, but was able to get added. And you also have it available as PDF. So this publisher has made it more accessible by having this particular software tool. So I can click on things like figures and tables, and they'll come up in a much more readable format or in a larger font. You can also increase font size and the like. So that is that tool, and that was found using Citation Matcher. So now many of you, or probably almost all of you, search PubMed or are familiar with PubMed. And so what we've done here, we've included this search bar. So if I were to type underserved women and children, that was one of the terms that was encouraged to search, and click on PubMed, I'm now going to go to PubMed itself. And if you haven't seen PubMed in a while, this is PubMed 2.0. What's nice about it is, once I click on a particular citation, I don't have to go back to the search results to see what the next one is. So for example, underserved pregnant postpartum women's access and use of their health records. That looks interesting. And it's in this journal. So I'm going to click on check PHDL, and let's see if it's in the collection. And it is included. And you see right to the right here, article is PDF. And now you have access to this article with the abstract. I know this is available because I also checked beforehand. This journal is available with issues from 2016 to 2018. But anytime you're not sure that it's in the collection or not, you can always just click on the check PHDL icon, and it'll either go to that article directly or to the web page of the publisher, or it'll go to what's called a document delivery page, and I'll be showing that to you in the slides. I have a couple of other examples I wanted to show you searching, but I want to see if we have any questions in the meantime. I don't see any questions in the chat. Just if you think of anything. Okay. Let's do another search in PubMed. And let's see if I got this right. So this is pretty lengthy. I did test this out, but the thing with PubMed, it's always getting updated, so you don't always know if your search results are always going to be in the same order of availability. So the reason I'm rolling over these and scrolling past them is because I know this journal is not in the collection. I want to show you what is in the collection and available. So this one looked interesting. I believe this might be an open access journal. I can double check that. I'm going to click on check PHDL. And this journal is included in the collection. So the International Journal of Health Services. This was a title that I really wasn't sure would be available, but it is. Oh, it should be full text access. I'm not sure why it says it doesn't say full text. Oh, it might be the, okay. Apologies for that. I thought we had access to that. Okay, so we have a question. So CLSI standards, right. So we go to the database. We'll go back to the climate change search in a minute because we got the question. I can click on all. And I believe it's listed under Eclipse. I have to double, oh, there it is. Okay. The general search bar, I'll go back to that in a moment. Okay. Yeah, so we have a question said, does the general search bar at the top of the search page search all available resources? I'll explain that in a moment. Let's see if we can get you. So here you notice it says username, state abbreviation, clsi.org, password, state abbreviation, and code. And Katie, I believe you have that code available on your website. It's really simple. So let's see if I can demo it. Oh, okay. So I believe it would be, so let's go back here. State abbreviation, I believe is, so it'd be ky@clsi.org. And I believe it's
This
1, 2,
is
3, 4.
ldh@clsi.org. The password is ldh123.
Oh, LDH. Okay.
Yeah, this is like the one database that has a special thing you have to enter. And
Yep.
so go on the OPH SharePoint page, you'll see a document that says how to access Public Health Digital Library, how to access. It's like a one-page sort of cheat sheet document, and it has this login and password. For some reason, this is just this one we have to enter this special secret code.
Yeah, so it's all uppercase or all lowercase for the password? I can't remember.
LDH uppercase at
okay.
CLSI, and the password is uppercase LDH123.
Okay, that's okay. That's interesting. Okay. So if you're familiar with it, this is the tool. You've got your categories. I admit I do not search this that often, but let's say I want COVID testing documents, I could click here. And now I have the testing documents. That is CLSI. Or as we call it, Eclipse, which has a CLSI documents. Okay, we had a question about the general search bar. So that was a great question. So if you're saying general search bar, thank you, Cheryl, for letting us know that it's going to save you lots of money. I call it the gift, the gift of time. And if you can calculate the ROI, then even better. The National Health Service of England has done that with their knowledge and library services, and I just attended a presentation this week on it, so trying to share that. So for this general search bar, you could search looking at the titles of the journals. So let's say if I type the word cell and click search, it's going to come up with journals that have the word cell in the title. I imagine if I were to search for a particular ISSN, whether it's print or electronic, it would come up with those too, but I haven't tried that before. But I tend to look at this general search bar as looking at titles or particular identifying pieces of information. So if I were to maybe do like Medline, you see as I type, it says Medline Plus, and that's a free database that's accessible. It tends to be used for consumer health, but it has some really good resources in it. So if I were to type in like acetaminophen, you can see it's matching the term. It'll have information about the drug, information about dosing. You can look at it based on the topics listed here. I could go under drugs and supplements and under categories. This tool tends to be as database used for consumer health, but it can also have information with citations and links to PubMed. And it's also freely available. So you don't have to be in the digital library to use it. This is something that is accessible by everyone on the internet. But that's just one of the databases included. If I were to say, let's type environmental, you get all these journals listed. So as you type, it matches. Another way to browse is by letter. Or you can also do like an advanced search. So I could say management. I guess it would search it. There we go. It took a moment. So everything with the word management in the title is coming up. And as you can see, there are 11 journals with that in the title, although it looks like some of them are around the topic of management, not necessarily directly with the title. So that gives you an idea of the variety of materials in the collection. So I go back to home. And I hope that it helps answer that general information question. I can show you more things, but what are the questions that you have in mind right now as you think about using this? Anything comes to mind, you can share. I had a tough one earlier and I got through it.
Yeah, I'd also encourage anyone to, if there's any journals that you particularly like, I'm just curious to know, put them in the chat if there's any, you know, I'm just curious what y'all are reading. And Cecilia, I know we had a lot of folks interested in, well, health equity, and I know you're going to talk a little bit more about health equity in terms of searching, as
Yep.
well as immunizations was a hot topic as well as in
Sure.
by people that registered.
Okay. So, and before, let me just mention also, there is a suggestion box. So if there's a journal or an ebook that you would really, really, really love to have, go ahead and click on the suggestion box. It'll take you a step-by-step process to list it. And if we start seeing the same ebook coming up or the same journal, we can try and see around the renewal season what could be added. We really don't like removing journals from the collection. We prefer to keep them if we can, but we do have to be conscientious of how much things cost, because the cost of the program is spread across all of the public health departments that are participating. Okay, so I see a question. If we come across an article that we cannot access here, is there a way to request it specifically? That is done at universities through the library. Wondering if we have a similar process. That is an excellent question, and you do have a similar process. You have an agreement with your partner library at Louisiana State University. So I can switch gears here and show you what that looks like. Let me just go back to the slides really quickly.
While you do that, I'll just say, yes, we are thrilled to be partnering with LSU Health Science Center as our partner library. Thank you so much, Emily, for asking that question. Something we wanted to go over with you all, that there is a special screen that will come up if you check the Public Health Digital Library and it says it's not there. It will give you a way to request it.
Okay, so we've done the demos. And this is just going to go through some of the stuff I mentioned earlier. Oh, this slide also shows you that there are other non-medical and health PHDL resources in the collection, including the Journal Health Affairs, Journal of Health Economics, a couple of indices, Green File and ERIC, and also an election law journal. So it is really quite varied and diverse. Citation matcher I showed you, I have steps for that. So this is our document delivery page. So what happens is we have the partnership with Louisiana State University Health Sciences Center. In this case, you would want to create what's called a new account, or an ILL, interlibrary loan account. And the information that needs to be filled in that's specific to your office is listed here on the slide. And then once that's done, after, let's say you search PubMed, you click on check PHDL, it'll take you to what's called a document delivery page. I'm going to show you what that's going to look like. It'll look something like this. So you would click on this, you'd fill this information in, and you would hit send. That would then take you to the library's interlibrary loan system, and you would log in with your account there and request the article. It'll take probably anywhere from 24 to 48 hours to get it. It might be even faster. It depends on their workload and also if they have the article available. So for questions that are beyond or more about the program or more about, scheduling a learning session or anything like that, you can contact me. I'm listed here on the contact slide. Questions about logging in, getting access, I would initially contact Katie or Flint, if I remember correctly, if Flint's also available. And if it's an issue beyond that, you can also email us at phdl@umassmed.edu. If you have questions about journal subscriptions, access to new materials, what's it looking like in the future for renewal season, you could contact my manager, javier.crespo@umassmed.edu. And if you have questions more about the nature of the program, how it's been set up and budgeted, or if you have things like you need statistics, which I believe those are going to be coming out in due time, you can also contact my manager. Also, I want to quickly mention we have a blog. We try to update it with announcements about timely classes and webinars, also issues around public health. New reports have come out. Sometimes we may feature a PHDL member department program. We also have a newsletter, comes out monthly. Our webinars and training calendar are listed for the entire NNLM. And included in those are sessions that offer CHES credit. So these are 1-hour webinars, or in some cases, maybe 1.5 hour that would offer CHES credit. And some of these are on demand, but the ones I've listed here are coming up, one in December and one in January, and those would offer 1 CHES credit. So those will be available. We have our evaluation here. I can keep this posted, and then questions. And I see that we have some things in the chat here. Let's see here. Okay, so that's about, see, it seems like CLSI is popular, the Eclipse tool.
I wanted to make one clarification. So,
Mhm.
we're not taking you all through the LSU paperwork, or, we showed you the screen that you have to sort of launching pad to get the LSU library loan. But I just wanted to reiterate, when you're doing that and putting in your information to receive the document from LSU library, please make sure you use your la.gov address and indicate, we have, they need to know that you are from the Louisiana Department of Health, Office of Public Health. So you can indicate this little shortcut that they've asked us here, or you can just write, Office of the Louisiana Department of Health, Office of Public Health, only because they need to know that the people they're giving their articles to are authorized, and we are authorized through this partnership. So you must use your la.gov address. Do not use your personal address to try to get articles, because they will not send them to you, and they will be asking me, who is this person? So just
Yeah, thank you for clarifying that. And that's another piece about the program. The cost of this interlibrary loan has been estimated. So the chargeback works is that our office pays for it. So your office has already paid for the service, is what to be expected, and then we basically pay the money back to the library. It's a little bit of a complicated thing the way it's structured, but that's what seems to work best. The reason we like to also offer trainings, we want to make sure that you're not trying to access something for interlibrary loan that's actually available already from the PHDL. So that is it. I can switch back to doing some demos. What are people into?
Yeah, maybe we can finish do our wrap up, you know, with a couple more demos. Did anyone have any other questions or concerns? Anything you would like to see a little bit more of by way of the demo? Or do you think you'll use this? I'd love to know. Give me a thumbs up or thumbs down.
Okay, that's a great question. So William is asking if I can do a multi-layer policy map demo. I can, but I have to tell you, I'll just send you the link from the YouTube video that was the training that was hosted by the Senior Data Services Policy Map Analyst the week before last, and she will show you exactly how to do it right. So I'm going to include that with the slides. Is that fair?
Wonderful, thank you. All right, y'all, any other questions, comments before we end? You can put them in the chat or unmute yourself to ask. Okay, great. Bridget will post, I will email all registrants. I'll email out the link to the recording and we'll also put it on our SharePoint site as well. The same site that we've got the link to the digital library and that link to that info sheet that I posted. Glad to know it was helpful.
Yeah, thank you everyone for attending today. Thank you for your time and attention. And always, if you have questions coming up or issues, I know creating your PHDL account or you need guidance, you can always email us at phdl@umsmed.edu.
Wonderful. Well, I'd like to go ahead and thank Cecilia so much for doing this webinar for us. This is an incredible resource. We appreciate so much your time to talk us through it. We appreciate having you on call to email with any questions. And again, you know, I'm also, for all of our staff members here at OPH, you can contact me as our sort of point person for this if you have any issues or questions. And I'd also love to know, by the way, if you get a lot of value out of the Public Health Digital Library, I'd love to know that too. You know, you're welcome to shoot me an email, say, hey, it came in really handy for this, that, or the other, because we do pay for it. And any sort of feedback that you guys have with regard to the value that it's providing you, you know, that is really helpful. So with that, I don't see any other questions in the chat, so we can end. I will stop recording and wish everyone to have a great day. Thank you so much.
Thank you, everyone. Have a wonderful day. Thank you, Katie and team, and I will see you next time.
Okay.